So I would like to introduce to you all Dr. Gelly.
Thank you. Well, that's a pretty hard act to follow, so I'll try and do my best. Today we're going to talk about the emerging specialty of wound care and why there is a specialty of wound care and how a wound care specialist can be best utilized in the community to help patients heal so that their quality of life improves. In the 21st century, we have to look at how we approach wounds that is different than the way we used to approach them in the past. The science behind wound healing has expanded exponentially over the last 10 or 15 years, and the available modalities have increased. I'll show you photos of patients that we treated with hyperbaric therapy, and these are antique photos because that's when hyperbaric was the only thing we did except wet to dries and IV antibiotics. Now it's very hard to find pictures of patients that are only getting hyperbaric therapy for their wounds. And the tried and true methods have been debunked. You know, wet to dry was always popular, but wet to dry has been found to be detrimental to wound healing. It should be wet to moist at a minimum. And then we need to know when a wound stalls and when that stalling process requires the expertise of someone who just concentrates in wound care. There's so much to learn in medicine these days that the average surgeon or the average internist can't possibly know all the new products, just like I don't know all the new antihypertensive medications that are out there.